Thank you very much to the organizer for their kind invitation. For me, it's an honor to be here. It's not the first time that I'm in Turkey. Actually, I worked with United Nations 2 years in your country, officially, in a diplomat corps in Ankara. And I've been here several times, and I hope it won't be the last one. Please. The aim of my presentation is called Ozon Therapy in Papillomavirus Infection. I'm a gynecologist, so the title of this presentation, the paper is already published. It's in a paper issued last year in the International Spanish Journal of Ozon Therapy. So if you want to check, you can download for free from the website of the AA Promo, Ozon Therapy Spanish Association. Let's go then. The human papillomavirus is a global concern. Today, it is suspected that there are 100 subtypes of HPV, according to genomic characteristics, present different risks and different oncogenic power. High-risk genotypes are found in 90% of cervical cancers. HPV-16, in particular, seems to be the most virulent. Cervical cancer is the 10th most common among women in Spain, and the second most frequent in women between 15 and 44 years of age. Approximately 610,000 new cancers per year, which means the 5% of all cancers, have been attributed to human papillomavirus infection, of which more than 80% occurred in developing countries. It is estimated that about 2.7% of women harbor cervical HPV infection at any given time, and 63.1% of invasive cervical cancers are attributed to genotypes 16 or 18. In Spain, women of 15 years and older, which are about 20.17 million, are at risk of developing cervical cancer. So we are in front of a very, very, very huge problem. The characteristic of this virus is very known. It's a small circular double-stranded DNA, non-enveloped, containing approximately 8,000 base pairs and 8 genes. HPV target cell is the keratinocyte, a stratified cell growth, since this virus needs this stratification to mature and to reproduce itself. The cellular receptor for the HPV type is alpha-6 beta B4 integrin present on the surface of the keratinocytes of the basal layer. Once the virus enters the cells, it will launch a series of mechanisms to deceive the security system cell, evade the immune response, and to integrate into human DNA to survive and replicate itself. The objective of this work, of this paper, of this research, using ozone was to verify the efficacy of the ozone alone and in combination with other complementary measures in the treatment of this infection in the cervix of patients who had not had spontaneous remission after 1 year from the first diagnosis. The second was prevent the virus from multiplying and infect new cells, decrease activation of toll-like receptors, and avoid excessive activations of nuclear transnuclear factor kappa. to favor the immune response of the dependent T cells as well as the dependent humoral beta response, thanks to a better presentation of antigens, rebalance the immune response controlling persistent infection and related diseases. Finally, to neutralize the production of viral oncoproteins involved in the origin of and progression of the neoplastic process. The keratinocytes, which are non-professional antigen-presenting cells, usually do not have the class II histocompatibility complex on their surface. However, under certain conditions, possibly in the presence of an exaggerated expression of pro-inflammatory mediators, HLA-DR molecules, which are typically found antigen-presenting cells, are expressed on the surface of keratinocytes. The objective of ozone therapy in this case is to hinder the appearance of HLA-DR molecules on the surface of the keratinocytes. In the case of cervical neoplasia associated with HPV, this is associated with the progression of the disease. This research was a monocentric, prospective, non-randomized interventional study with ozone and adjuvant therapies, which I'm going to explain later on. 30 male patients with a diagnosis of HPV were treated in a range of ages between 35 and 75 years old, between October 2014 and February 2017. So it's a very recent research. The inclusion criteria were scene 1 to scene 3 confirmed with all and recent cytology. Minimum of 8 months of evolution, maximum 5 years. Do not perform any other treatment. The exclusion criteria were perform other treatments, do not present the pap smears, and do not follow the guidelines. The protocol was as follows. We divided 2 groups. The one group, which was conformed with 20 women, were treated with ozone plus integrative therapy. In this group, was performed 10 ozone vaginal insufflations, 6 sessions of ozonated saline solution twice a week with a dose of 0.4 to 0.8 micrograms. So this is the dose that the patient received. IV administration of glutathione 600 milligrams plus 1 gram of vitamin C in a physiological solution, diluted, zinc and selenium infusion twice weekly. Microimmune therapy treatment in form of 2L PAPI from the laboratory, French laboratory Labolife for 3 to 6 months is a kind of homeopathic treatment, for your knowledge. And daily intravaginal application of ozonized oil at 600 index of peroxidation. Daily application of Fluvix, which is a gel with epidermal growth factor in order to prevent the dryness effect of ozone on the vaginal epithelium. The second group, the group conformed with 10 women, were treated exclusively with ozone in a form of vaginal insufflation at concentration of 20 micrograms per milliliter at continuous flow of 200 milliliters per minute during 10 minutes. That means the patient received more or less 2 liters of ozone continuously. Daily intravaginal application of ozonized oil at 600 index of peroxidation. I must say that these 2 oils are already registered and recently have been approved by European Union and by FDA in US. The age of the group treated with ozone plus integrative therapy were between 29 and 75 years old, with an average of age of 47. The scene were nine women with scene 1, 10 women with scene 2, and 1 woman with scene 3. Sorry. The second group treated exclusively with ozone. The average range of age was 27 to 41 years old, average age 35, and 1 person with scene 1, 5 persons with scene 2, and 1 person with scene 3 lesions. The evolution of the patient according to the criteria of therapeutic success, so positive, were with negative cytology after 3 months of therapy completion. The first group treated with ozone plus integrative therapy, so the resolution was 16 patients out of 20, with 80% of success. The second group treated exclusively with ozone, so it was resolved on 6 women out of 10, which represented the 60% of them. So the result, this is the most interesting thing. According to scene, so we can see here in the table, the patient with complete resolution, scene 1, 2, and 3. In the first group, the ozone plus integrative therapy resolved 16. The second group, 60, as I said before, represented the 80% of the whole patients. Patients who evolved to a lesser degree of scene were 1 and 1, represented the 6.6%. One of them received cauterization of the lesion of the neck of the womb, of the uterus. The patients whose lesions persisted were 1 and 1 in each group, and the one of them, the one who evolved to scene 3, went under conization or surgical conization of the neck of the uterus. Only one patient was treated for a condyloma giant, condyloma acuminata. This patient, I've seen it in Central America. This was my patient. I treated her about 1 month. In 22 days, we resolved her problem. We resolved the problem. So surgically, of course, this ozone cannot do it. So we have to act. We have to remove the condyloma surgically. And after that, I infiltrate all the lesions, all the area, with ozone in a type of, like a mesotherapy, using mesotherapy, or emphysema, doing an emphysema under the skin. And then watching the area, all the surface, with ozonized saline solution at high concentrations, and ending with ozonated oil at 800 index of peroxidation. We cannot work anymore without knowing the index of peroxidation. The oil is behaving as a medical drug. So, as we know, the concentration, for example, if we take an antibiotics using milligrams, in this case, the same, especially when we are working in gynecology. So, it started with 800 index of peroxidation. As the lesion healed, So we reduce immediately the concentration, the peroxidase number, to 600 and to 400, because the aim of the target, the aim of our treatment were changed. At the beginning was to kill the virus, to keep the area septic, away from the infection, and later on, when this was done, so the aim was to stimulate the healing of the tissue. And along with this, the patient received ozonized saline solution twice a week. And in 22 days, the problem was solved. We haven't seen, as a gynecologist, I haven't seen this before ever, such fast. So, as a conclusion, I might say that although the number of the patient treated in this research not allowed to achieve a safe conclusion, ozone therapy shown to be effective in a very complicated group of patients with no spontaneous remission during 1 year. So the data presented were more favorable to the group receiving the combination therapy, apparently because of the synergy of the complementary treatments that were administered. The ozone therapy is a simple, economical, and effective therapy. It was perfectly accepted by all patients. Apparently, the effects obtained are stable because we keep following them. It can be combined with other therapies and does not interfere with any other type of therapy as well. So, in order to end this presentation, we really suggest to continue research. We need research. We need more specialties involved, specialists, doctors, specialist doctor, who has more tools to work with this wonderful ozone therapy tool, in order to give us more instrument to keep going toward to health administration and to allow us to work freely in this. Thank you very much for your attention. I told you that I want to be short and open to any question, please.